When people are in training for a sport or some activity or just trying to get in better shape, they often come across the issue that one leg or arm, but usually legs and hips, have more internal rotation or external rotation than the other, and they want to get more. And they want to equal that out in the hope that that will increase performance or cut down on pain and discomfort. But the reality is that internal and external rotation of the hips, and so the leg, is really dependent upon the position that your pelvis is in and the rib cage. So this picture, you see that rib cage, it's a cadaver, obviously it's been dissected, so everything's been taken out of it. That rib cage is how we're all living to one degree or another. We're all oriented to the right. When a rib cage is living in that position and the spine is living in that position, the pelvis will also be living in the position. That's to the right. So this body, and we're in this position. Remember, you watching this video right now, because of your inherent right dominance, because of that bigger right diaphragm, because of the way that your organs are arranged internally, because of your brain's preference for right peripheral vision, because the right ear is faster than the left ear. We are all right dominant, and because of this right dominance, that is how people lie down on the table. You're not lying, when they come to see me and I test them, that's how they're lying down. They're not lying straight, even though they might look straight. When someone looks straight, we're just usually looking at the compensations of the twist that has to occur to stay straight. But that rib cage is how you are living. So we're all constrained with a system that prefers to be over on that right side, to orient ourselves to the right. The right, and you can see in the picture, the lumbar spine is oriented to the right, which means the pelvis will be oriented to the right as well. That's our natural position. So that is going to affect our internal rotation and external rotation. And so if you try just to stretch and just work on external and internal rotation of your hips without taking into account the position, the orientation of this rib cage that you're living with also, and the pelvis, you're not really going to have much effect. Now, the second half of this video is going to be a discussion with the gentleman that I was interviewing previously in the last video, Skip George, who's the instructor for the Postural Restoration Institute, and he teaches cervical revolution and postural respiration. And in the discussion, we're talking about constraint and how I ended up with such chronic pain in my early and mid 20s and even into my early 30s. It's one of constraint. My cranium was constrained. If you watch any of my previous videos, you know that my jaw and my cranial position were constrained. But not only that, I was physically constrained, but I was emotionally constrained. I was alienated. I was isolated because of the chronic pain. I was in a job I hated. So I was constrained by these environmental factors, and that's a big part of what goes into constraint of the body. And he'll also talk about the constraints that he had when he was a normal chiropractor. And it's just an interesting conversation. To understand this issue of internal rotation and external rotation, you have to understand all the influences that constrain us in society, jobs, relationships, religions, cultures. All of these, our own ideas, our own thoughts about ourselves, these are all things that constrain us and create tension and take away freedom to one degree or another. And life is very much about how much freedom you want to give up. But when there's too much constraint and too much tension, our body starts to tighten up and break down. On top of the fact that we're already constrained by our rightward domination. Now with this rib cage, like I said, will be normally underneath will be this left AIC pattern where the left pelvis is forward and the right pelvis is back, with a pelvis that's mostly oriented to the right and a center of gravity that shifts over to the right. And you know this because this is the test that you'll see almost every single time. This right leg abduction. In the first picture, it's limited. In the second picture, it's unlimited. The first picture, that's a right adductor that is overactive. That will prevent abduction and external rotation of the right leg. That's the normal pattern. Most right legs are lacking abduction and external rotation compared to the left side, not because there's anything wrong with the legs, but because of the patterned pelvis and rib cage and neck and head, possibly, on top of it. That's what limits that abduction and external rotation of the right leg. On the left side, the situation is reversed. On the left side, what you're going to see is usually a left leg that cannot adduct, so it cannot adduct, but it will have more abduction. So the situation is reversed on both sides, which also means the left leg will have an inability to adduct and internally rotate. So the two sides are different, but again, that's because of this position of the left AIC patterned pelvis. So the legs are inherently different. The right leg loves to be internally rotated. The left leg loves to be externally rotated to keep us upright so we can walk straight when our body is turned to the right. So what that means is the left leg is dying for internal rotation, and the right leg is dying for external rotation. But again, until the pelvis is neutral on top, there's no point in trying to stretch or do mobility exercises if the pelvis is locked into an asymmetric position, or if the ribcage is locked into an asymmetric position, which it likely will be because it's never going to be symmetrical to begin with. So just because our ribcage is asymmetric and likes to orient to the right doesn't mean that we can never obtain close to normal ranges of motion on each side. We can, because that ribcage also moves to the left if you can use your left side properly. But in a resting state, our brain will still prefer to have our body a little bit to the right compared to the left. The problem is getting neutral first, and that's what a PRI program is all about. So you can change those frontal plane tests, and then you'll find that internal rotation and external rotation of the legs will increase where they need to. But if they don't, then you might need to do some soft tissue work or some soft tissue stretching, for lack of a better word, to increase those ranges of motion because you've been stuck for too long. Not everybody needs to, but a lot of people do. And I'll show an example for the left side at the end of the video after the discussion with Skip George. So I hope you watch the discussion to understand constraint and how environmental constraint constrains our bodies. And I think you'll get a really much better understanding of what really forms these patterns, because it's really not the muscles, it's the brain. I found a book in 2005 or 2006. I found a book in Barnes & Noble, of all places, which was slightly different than every other exercise book that they had in there. It was called Core Performance by Mark Verstegen.
Yeah.
And
Athlete's Performance.
Yeah, exactly. So I found this book and I just happened to open it up, and I'm not a religious man, but it had to be divine intervention of one type or another, because I opened to the page that basically said, when people have tight hips, they'll often have back problems and other types of stuff. Now, I knew nothing about this back then. All I knew was what was in bodybuilding magazines. I wasn't even in the training world at that point. But I knew I had tight hips, and I knew I had a world of back problems. And so I said, this looks interesting, and I bought it. And when I went home, I tried doing just the warm-ups that are now called dynamic warm-ups, but he was calling them movement prep. And I couldn't even do those. The moment I tried to go into like a split squat type of position to stretch my hip flexors, I just started to shake uncontrollably and sweat. I couldn't even get through the warm-up. And so I started working on hip mobility, which I guess worked a little bit. Now I probably wouldn't do those same things knowing what I know now, but they worked enough so that the plantar fasciitis that I had in both feet for 4 years, which was just death, started going away. And I felt like I had a new life. And so I started dancing because I could actually stand up for the first time for more than 5 minutes without being in intense pain. Where my social life consisted of, in my 20s, this was my social life. Okay, sit home and just sit on a couch. I'm in my 20s, obviously, not what you want to be doing. But either sit home on my couch with my feet up and do nothing, or if I go out, will there be a place to sit? And a lot of the bars that we would go to when we were younger was so packed, there was nowhere to sit. Or if I can't sit, can I get so drunk that I will not feel the pain in those feet? That was my life for about 4 years.
Oh, that's brutal.
Along with the SI joint issues, neck spasms, tinnitus, shin splints, generalized hip pain, generalized back pain. It was just misery. And so that book kind of gave me a new life, because at least my plantar fasciitis started to dissipate. And then I started to take dance lessons, and life got a little bit better just by being in a better environment. Being around people who are happy and with music makes a big difference in how you feel about what's going on in your own body. So the pain wasn't quite so bad anymore, even though it was. But just being in a different environment really changes your nervous system to a degree. And so there was more positivity in my life at that point because I was dancing and enjoying. I would go from work 8 hours, 9 hours a day that I hated, and it was a very toxic, negative environment. And I went to a dance studio where people are happy, and I was like, oh, this is nice. It was nice. And I just went all in, and then I started to teach. I picked it up quickly, and then the people asked me to teach. And so I said, okay. And I started to make like $12 an hour teaching dance classes. Well, not a lot, but I then got into training because I saw this connection between the movement and the feet. And so I quit the IT job, did some random jobs for a couple of years while I was studying and getting into the training world. And that was kind of it. So I was doing the dancing at night and training during the day, or in the mornings at least. And then eventually I found PRI just through continuing education.
So then would you say that your vision, number one, was a major factor, but also just being combined, or not combined, but confined and converged in a box,
I would believe so.
all that. In
Yeah.
other words, the inability, especially when you're in your 20s, the inability to be able to just move freely.
Yeah.
And part of that is living in the city, right?
Yeah.
I mean,
Well, yeah,
I'm in the,
yeah, I'm in the suburbs, but
oh, okay.
yeah, I was not in New York City, but I'm in New Jersey. So I was in the suburbs, but yeah, I mean, I was inside with no natural sunlight. It was just the work. It was just the horrible, what are the lights? What are the fluorescent lights, I guess? I don't even know.
Yeah.
Just fake lights, no windows at all, and you're in cubicles. And that's what I was doing for 4 years. And I didn't even like it. That's the thing. I hated it. I just needed a job. But beyond the vision, then I was torsioned already. My jaw was still the main issue. And, so I was torsioned. So it was, and that compressed cranium, that compressed jaw, which was probably too far back, definitely too far back on the right side, maybe too far back on the left, which I would love to talk about with you because I want to know more about necks. I mean, I want people to know more about necks. Like I always say in my YouTube videos, it all comes back to the neck one way or the other. But I don't know that people understand the importance of that neck. And I figured that you would be a good person that could talk about, because they hear it from me, but it's still kind of abstract. And I would love to put it from the point of view of a chiropractor who studies this stuff, but then gets exposed to postural restoration, which has a slightly different take on things than most professions, and how that comes together in your mind and what that experience is to do something for so long and then be open to another way of looking at what you were already exposed to.
Well, I mean, it's a great subject. I mean, when I first started chiropractic, it was a long time ago. It seems like a universe far, far away when I first started. And really what we had when I first started was chiropractic adjustment. And I had a practice where I had an x-ray machine and staff and ultrasound and hot packs and diathermy and muscle stim and all those, what we call physical therapy, physiotherapy. And then I'd find some orthopedic exercise and hand it to somebody and say, go do this. Bye, see you later. Okay. So it was a practice and a business model where you saw a lot of people and went room to room. I was adjusting people, but then I started scratching my head after about a decade of doing this. What am I really doing? So I started asking questions, which is a dangerous thing. Mm-hmm. And after 15 years, I was waking up kind of depressed. It's like, well, is this going to be my life? Is this what I do? I feel like I don't have 15 years of experience. I've got 1 year of experience 15 times, kind of a cliche.
Yeah, okay.
So I sold my practice, took a year off, surfed, played my guitar and golfed, and got really bored. And then I started working in a gym because I wanted to go back to some of my roots. When I was in college, I had managed a bodybuilding gym in the San Fernando Valley called Vince's Gym. It's kind of well known at the time. It was part of that Southern California bodybuilding culture. Now, mind you, in high school, I smoked cigarettes, drank beer.
Yeah.
I wasn't really into health. I was a good athlete, but then I started working at Vista's gym. A friend of mine got me a job there. And it really changed my life because all of a sudden, here I am, 22, I'm working out for the first time seriously. And it's like, man, all of a sudden I got muscles. This is kind of cool being 22, muscle.
Very
And
easy.
a Volkswagen van. Okay.
Yeah.
So that was like living the SoCal dream. But the thing is, I went back to my roots and I could see that these personal trainers in this gym down in La Jolla were getting things like Paul Chek work and Verstegen, and they were branching out. Vladimir Yanda's work, McKenzie, that is, was seeping into the personal training world.
Mm-hmm.
And this was a very progressive group of trainers. And I thought, they're putting me to shame. They're doing things that I don't understand and I should.
What year would this have been roughly?
That would be 97.
Okay.
97, 98.
Okay.
And so in 1990, and I had taken a course, ART, active release technique, met a guy there that was just getting out of the Marine Corps, young Marine officer, and he and I opened up an office in La Jolla. It was a training facility with weights and kettlebells and not a traditional gym machine environment, but more of functional training. So I was exploring FMS and SFMA and McKenzie. And I went back to get my sports medicine advanced degree and rehab degree. And so I started looking. I was having lunch one day with a chiropractor by the name of Craig Liebenson. And Craig's pretty well known. He was personally mentored by Yanda and still very active in the rehab DNS world.
Mm-hmm.
We were having lunch one day and we were talking about all these different approaches. Functional movement screen and SFMA, DNS, and PRI. And I said, well, tell me about PRI, Craig. He said, well, I don't know much about it, but they deal with asymmetries in breathing and the liver's on one side of the body and not on the other and that sort of thing. So it intrigued me. And so it was 10 years ago, I took my first PRI course and it blew my mind.
Yeah.
I was pretty comfortable at that time in my career. Like I had retooled, let's put it that way, from a traditional practice to integrating functional rehab, personal training, and chiropractic, taping, I mean, you name it, Graston. And then PRI comes along into my life, or I entered PRI's world.
Yeah.
And I said, do I really want to go down this rabbit hole? Do I really want to do this? It's like, come on. And again, I just felt like I really don't know much. This is blowing my mind and blowing open a door into who knows where it's going to go.
What was your first course?
Postural restoration.
Respiration. Okay. Mine was myokin.
Yeah.
And I remember.
Yeah. Tell me about that.
Well, I remember it had to be 2013 or 14. Yeah. And it was tax day. It was April 15th. I remember that. So I was doing a home study. And I remember James Anderson was the presenter for that home study. And within 10 minutes, he was, at that point in time, I think I showed a picture of myself in the symposium last year where I was all jacked up. And I was living like that when I found PRI, when I found the home study. And I had a little bit of release through a psoas kind of massage, and things started to feel a little bit better, but I kept describing to people that I felt like I had a psoas muscle that just wouldn't turn off, that wouldn't quit. And James Anderson kind of described in the first 10 minutes the typical left AIC patient almost the exact same way. I said, oh my God, there's something here. And then he went into the asymmetry of the diaphragm, plural. And I said, what? Wait a minute, you have two? And because I used to always look at the picture of the diaphragm, singular, in these books like the American Council on Exercise and NSCA. They barely touched on it, If they even mentioned that we had a diaphragm at all, they just said one. They would just say diaphragm, and it's your breathing muscle. And I would look at its odd shape to the center of your body, and I would say, how does that muscle work? I don't get it. It's not this, it looks weird. And then it started to come back to me. Like when he said that, I had my, oh my God, this is it. And I was hooked. There was no turning back at that point.
Well, you know, it's funny you say that because I got into postural and I had kind of a cynical process because when James said in postural that walking and breathing are the same thing, it was such a new concept that all of a sudden all these warning flags went up. It's like, what? Come on, what are you talking about?
Yeah.
I couldn't really wrap my head around it. So, you know, day one and week one after the course, I'm having people doing 90-90s, blowing up balloons and not knowing what I'm doing.
Right.
But then, like you, I looked at the home study course, the myokine course, and all of a sudden, left hamstring, pelvis position, it went right back to my training from what's called Gonstead, the Gonstead approach in chiropractic. It's Gonstead is kind of one of the gold standards for pelvic alignment.
Okay.
And you mark x-rays and then you adjust accordingly and all that. And that put the hook in me. And all of a sudden it's like, I've got to know more. So I was a tough sell. I was really a tough sell. I mean, my brain at first was like, again, at the time I was 58 and I dive into PRI from there.
Yeah.
And, but yeah, same thing. Left hamstring hooked me big time.
I think one problem is I think a lot of people, they take the one course and don't understand that there's influences coming from the other half, and even well, I mean way more influences. But so if someone, because I remember reading a criticism of a PRI course that a seemingly intelligent physical therapist wrote, and he said he took the myokine course and enjoyed it, but couldn't believe that all these possible things, all these possible conditions that you're dealing with, hip pain, knee pain, back pain, could be coming just from an asymmetrical pelvis. I don't think he had any clue that there's a whole other, all these other influences influencing that pelvis, including the neck, which you eventually learn. Now, okay, so
that's the rabbit hole.
Yeah. Now, I had no clue about the neck in the beginning. Like, I just still thought it was all about the pelvis, and that was it, and that was was gonna save me. But then things were not progressing as I would have expected. And Lori Thompson, wait, that's her last name, right? Thompson?
Yeah.
I remember I was at her course in Connecticut, and we were all doing a technique, a standing wall-supported reach technique, and everyone's legs are shaking, and they're feeling their quads, and I'm looking around, and I'm not feeling a thing. And I said, all right, either I'm really, really strong, or there's something really wrong here. And so I asked her about that, and she looked at my face, and she said, I think you need to take the cervical revolution course, because she clearly saw my jaw completely shifted to the right side crossbite, the one eye just so much higher. So she looked at my face, stared right at it, and I said, you need to take this course. So then I realized when Ron put a plastic mouth guard in my mouth and I almost fell over when he wanted me to walk around the room, then my mind was completely, I no longer thought about muscles and bones in the same way, because then I realized something is completely different about this. I had to stop thinking from a strength and conditioning point of view, because I was still thinking of it like that for at least 4 years, because you think of them as exercises if you don't know any better. But then when my whole world changed because this $5 mouth guard was put over my bottom teeth, and he asked me to get up and walk around the room, and I almost fell down. Now, probably because I didn't have a functioning visual system, which I didn't know back then. But once that crossbite was taken out of my life, my brain had no clue how to stabilize me. And so I didn't know about the influences from up top. But obviously your training would have had a great deal of neck study in it. So,
but the problem with that, Neal, is that it was mainly orthopedic in approach, but it was also something that wasn't clearly defined. there are techniques within chiropractic that x-ray from different angles, the atlas and the occipital bone, the upper cervical, because within chiropractic, ever since the beginning of chiropractic, atlas is the big deal.
Okay.
You know, atlas is brainstem, atlas controls the whole show from a chiropractic perspective. Got that. But then what do you do with atlas? You adjust it, okay. And chiropractors early on could see that relationship of the upper cervical um, region, but our technology and our knowledge was somewhat limited and unfortunately got turned into more of a philosophy than a science, um, where there wasn't a more objective approach as to what's driving the whole system.
Okay.
Well, here I am, a chiropractor, beginning to suspect I thought I know something, but I really don't. And then I run into PRI, and here's this guy with the initials PT behind his name.
Mm-hmm.
But as you all know, Ron isn't your standard issue PT. He's like this neuro, well, wherever Ron is,
Right.
it's not of this earth.
Right.
So,
Right.
and I say that lovingly, because he can just see and synthesize, and that's really what Ron's done. He sees, he synthesizes it. So going back to the application of chiropractic, now I could see, after understanding first postural
Mm-hmm.
and the connection between breathing and neurorespiration.
Mm-hmm.
And then, we started getting a clue of, well, okay, so you have scalenes and you have an SCM that attach to neck and to skull from the thorax and the rib cage. So there's got to be a relationship there. Then all of a sudden, after I took cervical, it took me several times, and we've refined the course, that how vision and occlusion, obviously from the top down, will affect the entire system, including the cranium and the jaw, etc.
Mm-hmm.
But then learning how to integrate bottom up and top down, and that's the cervical course.
Yeah.
And you could see, for instance, you were having symptoms that were in your feet that had a major impact on your life. And then you had a sense, well, with being converged and the crossbite and all that, that this is really a top-down issue, starting with occlusion with you.
Yeah.
And how that occlusion affects your temporal bones, your sphenoid, your occipital bone, the alignment of the cervical spine.
Can you talk about that a little bit? Because that is a big thing. So I made a video last month, and I showed a picture of my cranial scan from my dentist, who's Dr. Hinden in New York.
Yeah.
And I showed the scan of my jaw is completely lopsided and rotated to the right. And you can see it on the scan. I mean, it's just like this. And so I got over 100,000 views on this video. And I think it's on YouTube. It's about two things: the title and the thumbnail. So I guess this thumbnail was pretty good because I juxtaposed the cranial picture scan with that jacked up picture of me and my lateral pelvic tilt. And so I said, was this, TMJ issue or a lateral pelvic tilt issue? Or I don't know if I said lateral mandibular tilt. Either way, it got a lot of views. And I just showed how I did not have a lateral pelvic tilt. It was just a visible symptom of a tilted body overall, universally. My feet were tilted, my legs were, my head was tilted, my temporal bones were tilted, everything was tilted. But if you can't just look at the pelvis and say, well, let's just treat the pelvis. And just as you just said, it was all coming from up here. And I couldn't resolve it because of a structural constraint that was in my cranium. And so cranium, what I'm getting at is, I got a lot of emails from people after that asking for advice because they've been told so many times that what they're experiencing in their mouth, they feel like they're twisted. And they're told they're crazy. They're told they're crazy all the time. It can't happen like that. And yet it does. So I can't help them too much online. I just kind of have to try to point them in the right direction. But if you could just speak on how that influence of the of the head on the neck and the jaw all come together to produce or reduce movement would be a helpful thing. So what I'm going to show now is an inhibition technique from postural restoration for inhibition or lengthening or stretching out the back of the left hip capsule, which often gets tight because of our left leg's desire to stay externally rotated to keep us straight when we walk because our pelvis is turned to the right. It's very common that the back of it will get pretty tight. So this is a technique that will open up that posterior hip capsule. So you'll see I'm on my hands and knees, my left foot is against the wall, and my right ankle is against my left leg. And I'm just rounding my back. I inhale through my nose, and as I exhale, I move back into the left a little bit. All you have to do is you can pause the video and just get yourself in this position. Make sure you're on your hands and knees. Back is rounded. Inhale through your nose, fill your back with air, exhale, and push back into the left each time you exhale a little bit, and you should feel a stretch in the back of your left hip. And I'll also put right here, this is the picture for the posterior right glute. Well, it's kind of the lower part of the right glute that often people will need on the right side. And this will free up external rotation of the right leg. So remember, the left leg needs internal rotation, generally. The right leg needs external rotation, generally. This is 85–90% of the people. Sometimes people are a little bit too stretched out to begin with everywhere, and they don't need any more. So it depends on the person, but this is the general idea. If you didn't see the first part of the discussion with Skip George, I think you could watch it. You can click right here, and you could watch that right now. And if you like the video, please like it or subscribe. Thanks.